Doctors and nurses are being called out of retirement to help their weary colleagues. CBS News medical contributor Dr. Tara Narula talked with Michele Pedicone as she left her practice as a respiratory therapist in Seattle. That was 2 years ago, to teach at Upstate Medical University. That's in Syracuse, New York. She's now returning to the front lines.
What is it about now that compelled you to want to reach out and come back into the workforce as a healthcare professional?
It's a calling on my heart. I need to help because I believe the systems are going to be overwhelmed.
Did you have discussions with your family about any safety concerns that you might have for yourself or for them?
So as a single mom, I have discussed this with my son because I wanted to make sure that he understood everything. He has seen me out in the hospitals most of his life, taking care of other people. And he said I could do it as long as I didn't get sick, which sounds like a really good deal.
Are you worried about your own safety?
Yes, I think that's normal. I think a little apprehension, maybe a little fear and anxiety can be healthy in this situation.
Are you worried at all about bringing COVID or coronavirus home to your son?
Absolutely, but I also recognize that I could bring it home going to the grocery store.
What has your family said to you about stepping up and back into the workforce? They called you a hero?
You know, interestingly enough, my father did call me a hero.
How did you feel hearing those words from your father?
Okay, so I cried for an hour and then I moved on.
Was there one moment that really made you say, I have to do this?
I think that one moment just came and hit me from side to side many times a day, and seeing how desperate the patients are and how desperate my coworkers are. There's no way I could just sit home and read their stories and not do something about it.
And Dr. Tara Narula joins us now. Doctor, good morning. One of the moments for me was when I was walking in my neighborhood and there's an electronic sign that the city puts out, and it actually was a call out to medical workers to return from retirement and come to the front lines. What's the significance of that request, and what role might it play?
Well, it's really inspiring to see how many people are stepping up. And this is a strategy that's being used by countries around the world. And it's truly an all hands on deck approach. We know we have a finite number of healthcare workers, a growing number of patients, and really a dwindling supply of healthcare providers, either because they are quarantined, they're at home taking care of their kids, or many of them are getting sick. And when you look at how many of them are getting infected themselves, the numbers are pretty staggering. Over 3,000 healthcare professionals infected in China, over 4,000 in Italy, over 5,000 in Spain. And, you know, we talk a lot about the supply of masks and ventilators, but those are things that, you know, when we decide to, we can ramp up production relatively quickly. It's not so the case with our healthcare providers. It takes years and years to train doctors and nurses and other healthcare professionals.
What about the healthcare professionals who have retired? Are there concerns about their age and there may be underlying symptoms that they may have?
Absolutely. I mean, we know that about 40% of doctors and nurses are over the age of 55. And as we've discussed, the older you are, the more underlying conditions you have, the more at risk you are for having a severe consequence or case of COVID. That being said, we're trying to figure out where to put these retirees that might be safer. Some of people are discussing using them in telehealth capacities now that those rules have changed. They can provide care across state lines, or in areas where they wouldn't be directly, you know, facing patients or dealing with patients.
You know what struck me, Tara, your interview with Michele Pedicone when she said, it's a calling on my heart. I think a lot of people in your profession feel that way. It's a calling on my heart. That was really lovely.
Absolutely. And, you know, last week, Mayor de Blasio said that over 1,000 people in New York City signed up in one day to help out. And it's not just our retirees that we're seeing step up. It's medical students as well. Many of them are helping to organize supply drives for masks. They're babysitting the kids of doctors that are called to the front line. And NYU just announced that they're going to graduate students early to help out if they want.
You know, everything helps during this time. Thank you, Tara.